Welcome to Health Tech Matters, a podcast brought to you by the Pankhurst Institute. I'm your host, Videha Sharma.
Hi, Emily and Pauline. It's great to have you today. Thanks for joining us.
Thanks for having us.
Thanks, Videha. It's great to be here.
I'd love to start to talk a little bit more about your journeys and your backgrounds. I know you both come from different backgrounds, but you've obviously coalesced around the digital health research space. I'd love to understand a little bit more how you ended up here and what have been the particularly memorable moments of your journey up till this point.
My background is around engineering. I always had an interest in health. I started out actually doing a lot of research in medical imaging. I worked for a couple of years also in human factors, doing assessments of healthcare technology. And when I started to think about a PhD, it was just when smartphones were being used more ubiquitously and just started to kind of think about how to use it for healthcare. So I became kind of interested in how do we start to kind of help people stay at home and do remote monitoring of people with different chronic conditions. And we actually started out with BlackBerries, if you guys remember what BlackBerries look like. So we did our first kind of work on my thesis around BlackBerries, had some really successful clinical trials with lots of positive findings. And then we went through a phase where I did a number of trials where I got quite bloodied and, where it should have worked, it didn't work. And I started to realize it's really not the technology, but really around kind of the kind of softer factors and things like, the healthcare system not being able to absorb new innovations. So that's kind of when I started getting really interested in kind of implementation science and looking at care models and really kind of thinking about how do you cross that second valley of death of innovations and try to get things into the hands of patients and providers.
That's great. And how about you, Pauline?
Yeah, thanks for that. So I think, like a lot of people, I really stumbled into digital health by accident. I started my career with a degree in computer science in Trinity College Dublin, and then I worked for quite a few years around the world as a software developer, engineer, technical consultant in various different kinds of industry. And then I moved to the UK in about 2006 and started working as a software engineer with John Ainsworth at the time to build a data collection platform across trials in mental health research. And that was really my first foray into digital health. At the time, I was pursuing a part-time master's in psychology, and it seemed like a really good way to combine computer science and psychology in terms of background. And this early work with John and Sean ultimately led us to the point where we were using smartphones to try and support people with mental illness, and that's work that we continue today, also with Professor Sandra Bucci. And over the years, I was lucky enough then to secure a funded studentship to do a PhD, and that PhD helped me to think about how research intersects with policy. And at the end of my PhD, I came back and digital health was really exploding at Manchester. So I rejoined John again, and we've been here ever since building, evaluating, designing digital health software. And then a few years ago, we established the GM Digital Research Unit at Greater Manchester Mental Health there with Professor Catherine Abel. It's our local NHS mental health trust, and we explore how digital technologies can support people with mental illness. And that's now also a key focus for my work.
That's great. I mean, listening to you both, you've obviously been able to bring your technology backgrounds and apply that into the healthcare setting. And particularly a challenge around healthcare innovation is overcoming that translational barrier. How do we actually start to impact patients on the clinical front line, and how do we get new technologies to make a difference? So I guess before we get into that a little bit more, I'd love for you to think a bit more about your journey and about the different roles you will have had during this period. And undoubtedly you would have had various roles as students when you're learning and trying to grow and develop yourself, but also you'll have had roles of responsibility. You'll have mentored and been responsible for other students and been seen as a leader at times. Any particular reflections on that, or anything that people that are listening to this can emulate from any positive experience that you may have had?
So, I think the first thing that kind of comes to mind is, especially in our area of healthcare, it is so very complex. I think when you're talking about, trying to mentor and become a leader, I think that, what I found is that, to tackle anything that's kind of meaningful in healthcare, you really need a true multidisciplinary team. And, when you kind of bring people with different perspectives and different strengths, but you also have to bring people who are kind of like-minded, right, in terms of their goals and really how they work. I think that's when kind of the magic happens, right? When you have like really good success, when you bring the right team together. And I've also had things flop because you just don't have the right people around the table. So, I think basically the ideal situation here is you bring together a team that you love to work with and you want to work with every day. Bring people who are smarter and more skilled than you are, right? And especially in their own different ways. And, I think that's when really success happens.
So just to pick up on something that you said around wanting to work with people that are like-minded, and undoubtedly that yields fruitful collaborations and undoubtedly has a positive impact on outcomes. However, you might not always encounter people that are like-minded. Do you have any thoughts, perhaps Pauline, on how you can help unify a vision, or if you do have strategy or an approach or something that you want to achieve, how you can get a team behind you more readily? Any particular approaches or any particular strategies that you've experienced that have worked, or perhaps times when it hasn't worked and you've had to change approach?
Yeah, thanks, Videha. So I think one of your other podcasts was about team science and team research, and I guess that's a kind of classic way that we work in digital health to bring teams together and enable people to work fruitfully together. I think all the work in digital health that I do is really collaborative and multidisciplinary, and that's really the only way to do digital health research. I think in terms of some of the challenges, often it's not the people, because I think oftentimes the people are one of the strengths of working in digital health, and having talented and inspiring people to work with is definitely one of the pluses of working in digital health. But I think some of the infrastructure around collaboration, so things like the speed of change in the NHS and working with big organisations, can be sometimes a bit frustrating to work with. So we know that things always move slowly in the NHS and in big institutions and universities. There's a real challenge, I think, as a leader there to try and get things to move as quickly as you would like, or to keep things moving along. And I think that can be a source of frustration for lots of team members, and just trying to keep people motivated, knowing that the timelines are moving a bit more slowly than you'd like.
Any thoughts from you, Emily, on that?
I agree with Pauline. I do also think that, there's different people with different kind of viewpoints. And, when you get the people who are really kind of passionate about what they're doing, I think that really shows, right? And I think we all kind of have come across people where you kind of talk to them and you just kind of click, right? And you kind of like understand what they're saying. And I think that's what I mean by like-minded. There's no lack of passionate people out there. And it's just about seeking them out and having the same vision and really having that drive for the same.
Great. I really, really enjoyed listening to that. I want to talk a little bit about your collaboration. And Pauline, you're of course based here in Manchester, and Emily, you're visiting from the University of Toronto. Picking up on something that you said, Pauline, around the pace of change, particularly in healthcare systems. And I think, Emily, you mentioned it early on as well, about how healthcare systems are not always readily absorb new innovation. So trying to build an international collaboration in this context in healthcare systems, what do you think are the potential advantages of that? And what do you think might be potential challenges around trying to do this across geographies?
Sure. So, I think that what kind of found is, I'm coming here from Toronto, is that there's a lot of similarities, actually. And I think one of the things that seem to be maybe even global is, that whole idea around pilotitis. And, and it's certainly happening in Canada anyways, and I see it happening in the UK, where, a lot of things are being innovated and really great things are happening. And it's really kind of a tragedy that it doesn't get into the hands of the patients and the providers. And, we're talking about, lifetimes of research, right? And millions, if not billions of dollars being wasted because of this. And so I think that, there's a real opportunity here to kind of work together and to kind of like figure out some of these evidence-based innovations that are kind of shown to work. How can we help to kind of get it used so that it can really help fix what are broken parts of the healthcare system, which I think is, an issue globally, really. I don't know, your thoughts, Pauline?
Yeah, thanks. I completely echo that, Emily. I think we know there's lots of well-evidenced products out there. Some have been through years of RCTs and evidence generation. But how do we get these tools to really bring benefit to patients? And that's really so important. It's the goal of everything that we're doing. But I think there's so many challenges there. And when I visited Toronto recently, it was striking how similar the challenges are there as they are here, even though healthcare provision is obviously slightly differently set up over there. So working together to try and overcome these things. I guess one of the benefits of having digital tools is things like accessibility and building tools that can be translated, and providing text-to-speech options and working with assistive technology. So we've got real potential to break down some of the traditional barriers in delivering healthcare and accessing people in remote locations. But if we can't find a way to realise and deploy some of these digital tools in the real world, then obviously they'll never get to patients. And that's, I think, the challenges are the same in Toronto as they are here. And there's real opportunity for us to work together to try and overcome them.
That's great. That's really, really interesting to hear. So this is something that I also reflect upon as you highlighted, Emily, to start off with, that though geographies may differ, a large proportion of the challenges are similar. Of course, there's going to be local differences and nuances depending on different settings, but there are parts of the problems that we can certainly solve together, and then there is individual local adaptation of solutions. So I'd love to hear a little bit more about some specific projects that you guys have got planned working on together. Anything that comes to mind that you think is exciting or that you're looking forward to?
I think there's already been some seed projects that we've started to work on here. Some of them I'm involved with, some of them are not. And I think that's kind of very exciting. I think what I've noticed is there's a lot of complementary kind of tools that are being developed in Canada and some in the UK. And, when we start to kind of bring them over the border, that's when, we can work as a team and really kind of push things and advance, healthcare. So, again, there's been a number of seed projects that have been funded. And I think that, again, very complementary in terms of skill sets. I mean, working on the same problem, but maybe from different angles. One of the things that I've been kind of working on and Pauline has been very much involved in is writing a grant, which has been submitted, and really kind of trying to understand these barriers and facilitators around international spread of digital innovations. So it's hard enough getting digital innovations that are even locally embedded as standard of care, but getting it across borders, I think, is particularly difficult.
Absolutely, but as we've also highlighted, also brings tremendous potential, right? Any thoughts on that, Pauline?
Yeah, absolutely. So alongside the work that Emily's been leading on around implementation and understanding how we can implement things sustainably across different healthcare settings, we're also doing some work with Toronto around building out the co-design infrastructure. So how do we co-design digital tools with patients and with healthcare professionals to really make sure that they're usable and trying to learn from each other's work. So here we've been very much focused on building digital health software for quite a long time, and over there they've got quite a lot of clinical expertise and what's needed within the healthcare setting. So sharing some of that knowledge is being proven to be really useful as well.
This podcast is brought to you by the Christabel Pankhurst Institute at the University of Manchester. At the Institute, we explore solutions to healthcare challenges by translating research into practice. We love to collaborate, so if you have an idea or would like to come on the podcast, please get in touch.
I wanted to pick up on your point, Emily, around writing a grant. Writing a grant is a really, really difficult, big task, can be onerous, especially if you're trying to work with lots of different collaborators. How have you found your very recent experience and any reflections on that?
Grants are always hard, no matter if you're doing it locally or internationally. One of the things that grants do is gives you time to think, right? And it forces you to think and it forces you to collaborate. And so I was very fortunate in that I was able to be here and meet new people that we have incorporated into the grant. It's actually a grant that's 3 countries, actually. It's Canada, the UK, and Australia, partly because of the strong ties that we have. But I think for all the difficulties and the struggles of writing a grant, again, the pluses are really that it forces you to think through some of these problems and do some planning. So even with parts of this, I think that, we're going to just do it regardless of the funding, which I think is exciting, right? And it's really about that kind of building those collaborations. That's the key.
That sounds great. And Pauline, you'll have written lots of funding applications in the past. Any thoughts or reflections on that process? Do you think the process is appropriate, effective, or do you think there are perhaps different ways of doing it coming out?
I suppose it depends on the day you ask me, Videha. If I've just won a grant application, then I definitely feel it's a great strategy. And if I've just lost one, then I feel it's a terrible idea. So a little bit depends on that. But what I think writing a grant application, and particularly a collaborative grant like Emily's been leading on recently, is that it really makes you think through the ideas in detail and to get your thoughts down on paper and to share them and to get feedback informally from other people and then formally, obviously, through the peer review process. That is really powerful. I think it really helps you identify what your priorities are, what your aims are, and what kind of resources you need to deliver on it. Unfortunately, the resources that come with the grant funding are not always matching your ideal vision for what you'd like to do, but that's one of the challenges, and it does really help you, I think, refine your ideas and also to gather feedback, because you usually submit these grants with large teams of collaborators coming from lots of different disciplines, and that's a real strength to the grant application process.
That's really, really good to hear. So thinking about resources and it being sometimes challenging for healthcare research teams or digital health research teams to have appropriate team members across disciplines with the right expertise to be able to deliver high quality research. Do you think there is a role for potentially diversifying people that are already in different research teams? I'm thinking out loud here about, for example, equipping healthcare professionals with digital health skills, be it design skills or maybe even coding skills or developer skills. Do you think that's a potential way of making those teams more active or making them more accessible?
Yeah, I think that, one of the things that I have seen kind of working around the training side of academia is that there's a lot of clinicians, I think is maybe what you're touching upon, that are kind of bridging out from clinical work and being trained in health services research in kind of like even more technical things like coding. So I think that's kind of exciting. And I think there's a lot of more kind of interdisciplinary teaching and learning going on. I will say, though, that no matter how much we do on that, can't know everything. I mean, it would take lifetimes for us to kind of like be the master of everything. And so I think that's kind of going back to what we talked about, is that you just have to kind of bring together the right people, but, still have those kind of connections and understand what each person can bring to the team. But certainly I think, starting to kind of think kind of big picture is great. You still need always, different team members. They will just bring skill sets that you'll never be able to catch or get in your lifetime.
Yeah, I completely agree with that. I think sometimes, maybe on rare occasions, you get people with multiple expertise, different kinds of expertise within the same person. But I think often it's really about facilitating the communication between experts in different areas. I think it's really hard for one person to be skilled to the level they need to be in every area. But obviously having frameworks and infrastructure where people can share knowledge and work in an interdisciplinary way is really important.
Great. So we've talked a little bit about leadership. We've talked a little bit about writing grants and about building the right team. Taking this journey forward and thinking about, well, now we've got a project that's on the go and we're generating some good quality evidence, and we now want to really think about that final translational step about bringing into practice. And Emily, you referred to the valley of death earlier. Any thoughts on how we can do that better? Does this require collaboration with industry partners? Do we need to be trying to influence policy or governments? Or do we need to work with local councils or perhaps citizen groups or patient groups to try to overcome this barrier? Any thoughts or ideas?
Fundamentally, there are kind of like two ways of getting things out there, right? There's the top to bottom idea and then the bottom to top. And so if you have those right money and the right resources and the will of government, you mentioned government, going from top to bottom could work. I think right now, most of the time, it's kind of the other way. It's the long haul. And by long haul, I mean decades or more of work. Going from grassroots and getting your foot in the door, slowly embedding the innovations and spreading. And I certainly feel that that's what we've done in my experiences as innovators and with a lot of the different innovators I've talked to. So, the real question here is that, is there a way to change the playing field really so that there's a higher probability of getting these innovations into the hands of patients and providers, and can we do it faster? And, I have to believe there is a way, or else we're really wasting our time. And, again, just kind of reflecting on what we need, I think it relates to a few things. I don't have the answers, but I think it relates to a few things such as, fundamental changes in the healthcare system so that, it can be incentivized to change. Right now, it's not incentivized to change. It's incentivized to do things as it always has. The second thing is maybe bringing together the stakeholders and including those policy and decision makers to align with the need, the money, and with innovations. And then, finally, really kind of focusing on the innovations that actually work and trying to spread those, because we have a lot of them.
And just picking up on what you've just described there, Emily, and picking up on your point earlier about co-design, Pauline, do you think bringing in these approaches around co-design and involving end users as part of your digital health project is another approach to help realize real-world adoption?
Yeah, I think co-design is really critical in involving as many stakeholders as possible early on in the phase to explore how feasible the solution is really going to be. But I think there's also, as Emily mentioned, this is a multi-pronged approach that we need. So there's challenges around funding for translational activity. There's challenges around commissioning and procurement and making those routes really transparent and having a clear process for procuring things. I don't think that's in place anywhere at the moment. It's usually really difficult for academics and digital health innovators to understand the pathway into the health system, particularly in the UK, I think elsewhere as well. So if we have an evidence-based product that's been through years of RCTs, for example, how can we deploy this, sustainably in the NHS? It's really, really challenging. And then it's about working directly with policymakers and with healthcare providers and with patients to understand which digital tools are really going to help them and which ones are going to bring benefit, and using evidence-based frameworks to establish that, and then following that through to deployment.
Great. I want to, as we come to a close, ask you a difficult, challenging question, if that's okay. You already mentioned, Pauline, about challenges around receiving funding, and we know that globally, certainly in the UK and in Western Europe, there's challenges around financial constraints at the moment. How do we as digital health researchers advocate for digital health research, and how do we share the value that digital health can provide in terms of long-term benefit for patients? Because it's not always apparent at the outset what the potential long-term benefits, both from a patient outcome as well as a potential cost saving, are to those that are perhaps holding the purse strings. Any thoughts on how we can ensure that this remains a priority area going forward?
Videha, I might actually challenge you on us not knowing, because I feel that we actually do know a lot, right? And there's a lot of evidence out there, right? And again, I'm not sure that, obviously we need more research and we need more funding for that, but I feel like what the missed opportunity here is to get out the things that we know already works. And I think that's the real challenge and the real tragedy of what's happening right now. We keep reinventing the wheel, and we do that in different countries, right? We don't talk to each other. We know sometimes what works, but we still can't get it done locally, and we certainly don't get it done internationally, right? So, when you start to think about technologies that have been embedded into standard of care locally, in theory, it should have already demonstrated efficacy, safety, and feasibility in some kind of context of being usable. And, those are the kind of things that make a huge difference, right? Because we don't have to kind of reinvent the wheel all the time, right? Like, let's learn from each other, spread the stuff that works, and I think that can make a huge difference.
Yeah, I completely agree. I think, finding ways to embed the things that we already know work or that have potential or that we've already invested huge amounts of money and time and effort into would be a fantastic start. I do think we've got lots of evidence that digital tools can help us. The challenge now is how do we implement them sustainably? Great.
And I wonder whether part of that challenge also revolves around how do we communicate those benefits to folks that perhaps are not that well informed around the potential benefits, right? So I guess reflecting myself upon speaking to senior stakeholders in the NHS is around communication. So perhaps that's also an area that we need to think about, is how do we communicate better to those who may not be that aware of the benefits as we are. Listen, thank you. It's been absolutely fantastic having you both on today. I've really, really enjoyed listening to your answers. Thank you so much for joining us, and good luck, and I hope to see you soon again.
Well, thanks for having us, Videha.
Thanks, Videha.